Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then Perkins quadrants. Right. In Perkins quadrants, actually, whenever there is two lines, one we have this is the Hilgenriner's line, which is actually going through the mid portion or midpoint of the acetabulum. So this is Hilgenriner's lines, and these two are actually the Perkins lines, which are going on the superior aspect of the acetabulum perpendicular to the Hilgenriner's lines. So these Perkins lines and Hilgenriner's lines will actually intersect with each other, and they divide the this part into four quadrants. Okay, so this is called as Perkins quadrants. So these quadrants are called as Perkins quadrants. When these two lines intersect with each other, they create quadrants called as Perkins quadrants. Normal location of head of the femur is present in inner and lower quadrant. Normally, the head of the femur is located in inner and lower quadrant, whereas in conditions like developmental dysplasia of the hip, it is located outer quadrant. So it is simple. Here you can see this is the normal head which is located in the inner and lower quadrant, but here there is developmental dysplasia of the hip which is located in the outer and upper and outer quadrant.
thank you and thank you for watching.